system under pressure with an ageing population and rising costs, particularly for nurses and doctors' wages, has triggered a fresh row over who picks up the tab for Australia's 700 public hospitals and 500,000 healthcare workers.
So we're going backwards, we're not going forward. So the idea that we're on the brink or the precipice of a deal is a long way off. And I mean, ultimately, the way this will be managed is that people will be turned away from emergency departments.
A conga line of state premiers has lashed out in recent days at the Albanese government, which they accuse of watering down a 2023 deal that would have seen the Commonwealth pick up a rising share of the healthcare bill, in turn for the states accepting more of the NDIS burden.
We are seeing more and more is being asked of our hospital system. With an ageing population, a growing population.
It shouldn't be up to a level of government that only has a small portion of the tax revenue to pay for the lion's share of health.
That will reduce health funding for Tasmanians by some $673 million over 5 years. That's the equivalent of 128,000 elective surgeries.
There are 280 people, as we speak, in South Australian hospital beds that don't need to be there. They're stuck there because there's no aged care bed for them.
But Commonwealth funding, at the end of the day, is important.
The sour mood is a stark contrast to nearly 2 years ago, when the Prime Minister hailed a major breakthrough.
Today we've agreed effectively on the parameters of the next 2 5-year health agreements. This provides certainty for state and territory governments to be able to deliver the health care that they want.
All part of a grand bargain to manage Australia's rapidly expanding care economy, curbing runaway NDIS spending in exchange for more Commonwealth health dollars to the states.
We end 2023 showing that federal-state relations can truly be harmonised and harnessed in a way that benefits our entire constituency.
Since then, the prime ministerial optimism has faded. Costs across the system have risen precipitously, particularly off the back of big wage deals for healthcare workers led by Victoria. In February, with an election on the horizon, the Commonwealth instead cut a deal for a 12-month funding boost.
To this afternoon's announcement, which is a cracker that I'm very pleased with. What you do?
An interim agreement to fund states an extra $1.7 billion to help mute tensions in the lead-up to the federal election and allowing the federal government to make a virtue of sound and sensible intergovernmental relations, a key element of his pre-election pitch as the nation's leading guardian of healthcare.
One card covers it all. Not your credit card, this, your Medicare card.
In August came the first signs of a harsher post-election reality. Federal Minister Mark Butler surprised the states by urging them to match Commonwealth funding for the so-called Thriving Kids program, aimed at moving autistic children off the NDIS.
And we've got to introduce more discipline and integrity into this scheme. The sort of discipline and integrity you see in health, aged care and veterans care.
This week, state and territory leaders met to discuss the federal government's proposal. Since then, they've been on the warpath.
The states do have a legitimate concern because the cost of care has been spiking up in recent years. The amount that the Commonwealth has agreed to tip in isn't covering as much of the costs as was previously planned.
The worsening funding clash now threatens to undermine the government's credibility on healthcare. The Commonwealth wants to shift more responsibility for the NDIS onto states and territories, giving the federal government more scope to boost spending in areas like defence and universal childcare. And it's putting pressure on the states to work on health and NDIS deals. The federal government's view is that its current offer for increased annual health spending will leave the states better off, with a promise of more money for primary and aged care services that keep people out of state-run hospitals.
That way you can get a quid pro quo where the Commonwealth sees, okay, we're going to start extracting some of the avoidable costs in the system, drive down waste, increase productivity, but the states get more certainty and security that the amount of money coming from the Commonwealth is sufficient.
The rough and tumble of politics usually favours the short-term fix over something more enduring. But the challenges of cost blowouts in healthcare, disability services and an ageing population are profound. Labor governments dominate the majority of federal, state and territory jurisdictions, making this a test of their ability to avoid another collective failure.
It's called a reform agreement, but it's just a financing agreement. It's just really about who pays for hospital care. We need something much bolder to make the system work better.
The feds have got deeper pockets. We appreciate they're under pressure with the NDIS, but we need help to run some of the biggest public hospitals in the country, if not the world.